Welcome to Black Health Matters. I'm your host, Daryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Already vaccinated, so a desire to have herd mentality is insane to say the least. And that's his comment about it as well. So uh, whoever thought of that should think again about something else. And it's not a disease that it's fun. It's a disease that kills and kills and paralyzes and causes all kinds of problems. So you need the vaccine. That's what you need. Yeah. 2 shots of the vaccine is 97% protective. And it's good to hear that RFK agrees with this. So that's good. Okay. Okay, let's go to the next one. That's a great article. Uh, um, and it's good to see that Kennedy's in favor of it as well. So, okay. Next article, please. Yeah, this is an article that talks about the fact that now we're having fentanyl combined with not only with heroin, but other stimulants. And they're reacting to the fact that the overdose deaths from drugs has dropped some, which is good news. And we would like it to continue. But what he's disturbed about is that the products that are coming in from outside of the country are still laced with fentanyl, and now they're adding other stimulants to it, so that we have to be careful to advise our children and grandchildren and great grandchildren to avoid the drugs that they're dispensing, because they have so many different ways of getting you high, but also killing you. And it talks in detail about the different locations and the fact that one thing that is common is that the fentanyl is part of what they are using for the drug that is distributing. And fentanyl in any form is a good anesthetic. That's a nice way of putting it. It's a good anesthetic. It puts you to sleep. And if you take too much of it, it puts you to sleep permanently. So, so keep your children, your grandchildren, and great grandchildren away from it. Taking substances from anyone that they don't know about, because it's likely to have heroin or fentanyl or some other lethal drug. Nowadays, having pure heroin is unlikely. It's likely to be laced with other stimulants and fentanyl as well. So it is good news that the overdose deaths are decreasing. And I think some of it is related to the fact that we now have dispensed liberally the antidote. So still, many of the substance abusers are not under care. What is frightening is the fact that we have so many people who are substance abusers who take drugs for their problem, and so they are under control, and that's important because otherwise we'd be a nation of zombies. Any comments about this as we address this concern with our uh, uh, adults and children and grandchildren?
Good morning. This is Charles Davis. I want to go a little bit political. I thought I was reading somewhere with the new control, quote unquote, controls on the southern borders that is limiting the fentanyl coming into the country, which the current administration is beginning to, as you spoke, I think you're saying also the fact that it seems to be less of the amount that's fentanyl that is in whatever forms is coming in now. What are your thoughts on that?
I think that thank you very much for bringing that out because there are positive things that occur as a consequence of the new administration. We tend to look at the many negative things, but there are some positive aspects of it. Thank you for sharing. Daryl.
Yeah, this is all kind of fentanyl. It's new stuff for us, for me anyway. Wasn't with my generation. And with my generation, things like heroin where you're tied off and shot up. Um, Fentanyl is a lot cleaner. It's distributed as a pill or a tablet. And kids don't go around calling it fentanyl, but they have all kind of nicknames for it that we wouldn't be aware of. Like they call it Apache, China Girl, Chinatown, Dance Fever, Friend, Goodfellas, Great Bear, He-Man, Jackpot, King Ivory, Murder 8, Tango, and Cash. And so if you hear your grandkids talking about a term that you don't understand, ask them what it means because, you know, it's got a cleaner look to it. They're taking a pill or a tablet and it can completely get biased because we expect for drugs to be something like we knew, but this isn't like that at all. They're not snorting it, they're not shooting it, they're just popping a pill, and they got all kind of great nicknames that get right by us.
Thanks so much for sharing that. That's a very important aspect that we tend not to be aware of because, as you said, it's a different generation. Okay, if there are not any other comments, let's go to the next one. And please be liberal in your sharing your thoughts about these articles. Now, this is something that we kind of suspected, but nobody had really done a large study. But this study was done over a 7-year period and identified that people who are depressed have low physical activity and smoke often, and as a consequence, they develop a lot of chronic health conditions. And so, as we treat depression, we have to address these issues because depression is not a isolated problem, but it's a problem that involves the entire body. And so, as we treat the depression, we have to also recognize that the low physical activity and other things that are done along those lines are killing our people. And here's a study of 172,000 participants from the UK. And yes, it is UK, not the United States, but it's probably applicable. And and I think the goal of this article is to have us to recognize that people who are depressed, uh, that's just part of the problem. And so we have to address the problem holistically so that we address all aspects of what goes along with depression and try to make sure they're physically active, that they're not doing other things that aren't healthy. And as you can see, some of the other conditions, hypertension, osteoarthritis, gastroesophageal reflux, among other things, can be addressed by lifestyle changes. So, it's not just enough to take the antidepressants, but you've got to actually change the lifestyle along with it. And as we all know, depression is one of the commonest mental health issues. John Buchanan.
Yes. What do they mean by comorbidities? Is that
Other conditions.
I,
Other conditions.
okay?
Like they're talking about hypertension, diabetes, and there are a host of other conditions that go along with depression. And now we're learning that they often are contributed to or caused by the whole mental attitude and body habitus of those people who have depression and are not exercising and not adopting a healthy lifestyle. So emphasizing that these comorbidities is what we call them are caused also by the mental attitude that goes along with depression. So depression is a serious disease that we can't take lightly, and because of it, these other conditions prevail. Any other questions or comments relative to uh, depression? One of the commonest of the mental illnesses.
And um, one that so often the church, where we get many positive messages about behavioral change and health, stressing depression is very important and should not be taken lightly, simply prayed away. And I know for adolescents, and I've had quite a few of them that were clinically depressed, pointing out the mental retardation that occurs with depression. So, the aspect that when you are depressed, you are not thinking as well. And because you are not thinking as well, you are not living up to your highest potential. And that this can be an economic catastrophe that can be treated pharmaceutically as well as with talk therapy. So I'm just saying that I know so many people in my life who have been depressed and are willing to remain in that posture are diminishing so much of what life has to offer.
Thank you very much, Dr. Perez. And Dr. John Tatum, you had a comment.
Yeah, I really believe that some people are depressed and don't realize that they are.
Oh, yeah, I'm sure there are many that don't. And that's why Dr. Perez's point about going to church and praying for depression is important, but as important is getting mental health care and recognizing that this is a disease entity that is associated with many other diseases if it is not treated appropriately. So thank you very much for all those comments. Any additional comments on this lethal mental health issue? We're not even talking about the many people who commit suicide and the other things that occur. But we're talking about the comorbidities and the additional disease entities, as you see here, which are just a small amount. That's just a small number of disease entities that is associated with depression. There are many more.
The other thing, Dr. Calendar, is I believe that some people are reluctant about getting help.
Yeah, well, the stigma of going to the psychiatrist is still with us, and we've got to overcome it. It's part of our health to take care of our physical, mental, and spiritual health. Daryl, you have a comment.
Yeah, it's societal too. People are eating to feel better. They're eating their way out of depression, and that's why we're such an obese society. And it's really starting young. We say that diabetes used to be an old people's disease, and now it's a disease that's affecting a lot of teenagers.
Yeah, yeah.
And but just part of like what changed. Okay, I'm in Chicago. I don't live in the city, in what they call the urban areas. But in the urban areas, typically, if you're a child, you grow up depressed because you go to school. After school, you can't go out because if you go out, you're in the neighborhood. You're probably going to get shot. And so what do? You stay inside for the rest of the evening and you watch TV and eat. You get fatter and fatter. You get depressed because you're scared for your well-being. You can't go outside. Or if you do want to go outside, then you join a gang and you join a gang, you're
Mm.
depressed because it's you're thinking, well, now I'm in a gang. I'm not going to live past my 20s. If I get that, I'll be an old man in my 20s, and so you're scared all the time, and that fear drives depression. So, it's a heck of a thing being in America and being a young person these days. How to escape all of that without being depressed means that you have to escape to the suburbs.
Thank you for sharing, Daryl. Betty?
Yes. What really are some of the signs that you can just, you know, watch a person and realize that they're in depression? Because a lot of times you, like Daryl said, you don't really know they're in depression until it's too late or they've killed themselves, and then you say that, they're depressed.
It's difficult to tell because, one of the things we talk about both bipolar people who are manic depressive, and in their manic moods, they're active and laughing and joking and talking and all that stuff. But then the other side of it is the depressive side, in which they can be suicidal. So sometimes it's hard to tell. Don't You can't be deceived by the fact that somebody appears to be outgoing and appears to be happy and easygoing, because it's interesting. So many comedians are depressed, and so it's hard to tell. Yes, you can tell if they're in their depressed mood and they're inactive and unwilling to socialize, but oftentimes they're bipolar. They have the manic phase and the depressive phase, and so. But certainly, if somebody is isolated and is not taking care of himself, and let the personal hygiene go down, or if they are inactive, those are signs. But very often, many of the people who wind up committing suicide are people who uh, uh, give you the other side of that ledger, that is the manic side, and so you think they're okay. So often it's difficult to identify that person who is uh, clinically depressed, but also has other features of the mental health issue.
Dr. Calendar, I think some people who are depressed are always going around in the dark during the day. The lights are all dark all the time. They wear black, they don't participate, they're antisocial, things like that.
Yeah, those are the ones who are easy to tell, and they require treatment even more aggressively. But it's the other ones who I've been surprised at, who uh, laugh and talk and joke and all that stuff, and then you find out deeply inside they have the depressed moments, which you don't see. And so yeah, for those people who are just totally depressed, they manifest it by withdrawing and being antisocial. But there are others who are outspoken, and that's a phase they go through. But they also have that withdrawn, depressed aspect of it. Any other comments about this very difficult problem? Betty, you had another comment?
Yes. And the one thing that I really began to understand that there were people that were depressed. I don't know whether anyone else remembers this, but when John Wilson, the representative here, I saw him campaigning in Southwest just weeks or maybe days, And the next thing I heard, he had killed himself.
That's right. Yeah.
And that when it really hit home to me that something, how can you know, people need help, but you don't know they need help. So
That's one of the features of depression that is more alarming than anything else, as you mentioned, because you have people who have both phases of it, the manic and the depressive phase. And you may catch them in the manic phase and think they're okay, when in point of fact, it's not the case. Carol?
I've come to the realization, well, I like to, besides talk about it, know the action. So if we are depressed, we are to seek help, mental health, or phase, or what are the steps when we feel depressed? And what are the steps when we think someone else is depressed and they're close to us and might listen to us?
Well, one of the things that is important.
One more thing is I know sometimes when especially I was teaching in high school, and you would see depression among teenagers, and some things they would get depressed about. And I had no idea because I would dismiss it. Like they broke up and they're outside the classroom crying because they broke up. Well, they really do go through that. And some of them even attempt to do suicide, when I easily dismiss, oh, they're just going through a phase. So the steps that I need to know when you feel yourself depressed, when you see others that are close to you are depressed.
Well, see, depression is something that you decide exists when you stay depressed for more than 2 to 3 weeks about something. Because everyone has phases of depression in which, you lose your loved one, you lose this and that. And so you may be depressed for a short period of time. So that isn't the same thing as someone who, after an episode like that, stays depressed for more than 2 to 3 weeks. When they stay depressed for more than 2 to 3 weeks, then that's a sign that they need to seek help, need to get mental health. So that's one of the commonest signs, is when they stay down for more than 2 to 3 weeks. But that's just those who are in that phase of depression. But as Betty mentioned, there are other people who are manic depressive, and so they trick you into thinking that they're okay when in point of fact they're not. But if you see somebody's down for more than 2 to 3 weeks, then they are clinically depressed and they need mental health care. I saw Lucille Perez and then Daryl Armstead.
Just one more thing. Where do you find them? You go to your primary care, or who do you go to, or you look it up on the internet, the
You
closest?
can go to your primary care and he can refer you to a mental health specialist,
Okay.
because he would introduce you to he would refer you to a mental health specialist, a psychiatrist, or a psychologist. Okay. Daryl, I think you were next, and then Lucy.
Oh, Dr. Perez was next.
Okay, Dr. Perez.
After you, Darryl.
Okay. There's a comedian named Stephen Wright that said, depression is merely anger without enthusiasm. And so, but the source of anger, depression, it all comes from the same place. It's denial of entitlement. And so it's the feeling that leads to anger or depression is, I deserve better than what I'm getting. And that's what psychologists or psychiatrists try to deal with when treating somebody with depression or anger issues. Because what they have to get over, like we always say, get over yourself. Reality is that, yeah, we all think we're entitled, but reality is that none of us are entitled to anything except for to take our next breath as the Lord allows.
Thank you for saying it that way. Dr. Perez and then Deacon Davis.
I think it's also very important for us to have a community, an atmosphere that's receptive to someone checking out. There are so many less than 5 minute assessments that one can take or be given that talks about the level of whether one is depressed or not. Dietary things that impact depression that we miss. And it's another personal responsibility that we can take, and that's checking in on people, especially more seniors. It's ridiculous in adolescence, to the point that developing brains don't develop because they're depressed, and appropriate neural pathways aren't being made because they're depressed. So it's a really, really big issue. And in our community, treatment in terms of trying to get an adolescent to a psychiatrist, the DMV, I mean, it's harder than getting somebody into drug treatment.
Thank you for sharing, Deacon Davis.
Yes, sir. Back on both the Dr. Perez and Carol Tatum speaking. Ms. Tatum spoke of the high school situation, and I'm associated with the youth program also. And now we are not to just pass off these what we would think as they're just going through phases. Though those are key things now we've been keyed into. We have to pay attention to, and as because of depression and the suicides within youth levels. So definitely, I mean, we get keyed in on that almost once a month now to pay attention to that. And also, I think Dr. Perez was saying about, getting an adolescent to a psychologist, a psychiatrist of the sort. And that is something that, another end of what, we've been told that we're going to work hard to make more available for our situations of, but one, the youth suicides. Thank you.
Thank you very much, Deacon Davis, because one of the issues that really was brought to our attention was the fact that after COVID, teenage suicide increased, particularly in our people of color. And so that's just something that we do need to be alarmed about and to address it as quickly and as thoroughly as possible whenever the signs present themselves. Yes, Dr. Perez?
And the fact that close to half of the Department of Education has been fired. Many of the programs that we've put in place have been through the Department of Education, especially with children with special needs, families with special needs, and all of those programs in the Department of Ed, so that they would not be, we wouldn't parcel them off, so that our communities, Black communities, urban communities, would get the resources that they needed from a federal standpoint and not be diminished because of where they live and their impact on the state. So now, your boyfriend, Elon Musk, and his minions have cut out what I have fought for my entire career.
Right. So the question is, what can we do about it? Because the observation is quite correct. The question now, though, is what is the next step? Because there's no question that has happened and will continue to happen. And the question is, what is the next step? And as we talk about the comment that Carol Tatum made, that this is the number one issue that communities are addressing and are now beginning to address, and we're only seeing the early stages of it because it's going to get much worse. The question is, what is the next step for us as we press the fact that most of the issues that we fought for are going to be lost over the next 12 months. Any other comments as we move forward?
Do you want a North Central Brooklyn strategy for eliminating two guys that need to leave? Or would you like another approach? Because we know how to take care of some stuff.
Well, question, I don't think we do. My opinion is we do not. And so, yes, we do need a strategy.
I just have one more statement. Daryl brought up an important part, entitlement. We in America have made our society think that everyone is entitled to everything. In the school system, everyone has an entitlement to get a college education, whether you're mentally capable or not. Everybody is entitled to live a rich life. There is no culture where everybody is rich. So the rich get richer, the poor get poorer. So if you're poor, it's your fault. Race relation, entitlement. So if you're of the right persuasion in the race, everyone is entitled. So they'll say that everybody has equal rights, have equal entitlement. So when you don't have these conditions of a happy life, no divorce, everybody rich, everybody like Dagwood and Blondie, then everybody will be fine. And we're coming to the point, even when we have children, we believe that every child should have a separate bedroom instead of everybody piled up together where you had to face each motion. The entitlement, everybody should have a chicken in every pot. So with the entitlement, there's going to be a lot of depressed people because they'll say, why don't I have this? And health. If you eat the right things, you're going to be healthy and you're going to live forever. If you die, it's your fault. So entitlement has a lot to do with the depression. And the more we'll say that everybody has the same privilege, same mental conditions and all of that, it's going to be a lot of segment of people that are going to be depressed because they don't have the same thing that everybody else has.
Okay, let's go on to the next article because what she says is pretty true. And the fact is no one is entitled to anything, particularly with the new administration. This is an article that is an interesting one because it says doing one thing for 5 minutes a day can lower your dementia risk. And they go into detail what they found by this Johns Hopkins study, that the more exercise you do, the more likely you are to have your risk for dementia drop. And it's something that we've been talking about forever. And I think it's important not to take it for granted, but we've been talking about the fact that exercising for 30 minutes a day, 5 days a week is the minimum of what you should do. And this article just points out that the more exercise you do, the less likely you ought to have dementia. It also talks about the symptoms of dementia, which are pretty clear. But the fact that physical activity, 30 minutes a day, five days a week, the minimum, is something that significantly decreases the risk of you developing dementia. Any comments on this article that emphasizes something that we've been talking about for decades now? And the question is, how many of you actually exercise at least 30 minutes a day, 5 days a week? And I hope it's 100%. Daryl, and then Dr. Perez.
Yeah, to a lot of people, that 30 minutes a day is an elephant. You say, I can't eat that elephant. It's too big. I can't get him on my plate. But the way to do that 30 minutes a day, if it feels like an elephant to you, I know it doesn't feel like an elephant to John Buchanan because, he's way ahead of that 30 minutes a day. But the way you do it is you say you eat that elephant a bite at a time. So, like the article says 5 minutes a day, but you do that 5 minutes 6 times a day and bingo, you're there at 30 minutes.
Thank you for sharing, Daryl. Lucy?
Another area with ICE and the fact that foot traffic and our brothers and sisters that are in the Bible, they call it foreigners, that are now at risk because their activity is down to nothing. Significant interpersonal, personal healthcare changes in a population that is afraid to be seen is scary.
Being afraid to be seen doesn't stop you from exercising. Betty, did you have a comment?
Yes. I see several women on here, but women, when you say exercise, do you mean just routines, or is exercise what we women do every day, cleaning
Well,
the house and
aerobic exercises are exercises that increase your pulse and heart rate. And so we're talking about aerobic exercises that
okay.
increase your heart rate. So that we're talking about walking and those kinds of things. And then, of course, if you have some ailment that stops you from walking, there are ways to do exercise in the water. So exercise that will increase your heart rate is what we're talking about.
Going up and down the
So-called
steps
aerobic
10
exercise.
times, going up and down the steps 10 times a day doesn't get it.
Well, what you do, you need to do it 30 minutes a day for 5 days a week. That's the minimum. So you can walk around your room.
Yeah, I do that. I do
Yeah,
that.
walk around your room. My exercise every morning is for 1 hour. I walk.
Yeah.
So there are all kinds of exercise. You can walk, you can jog, you can swim, you can do all manner. But the goal is to increase your heart rate and we call those aerobic exercises. And then of course there's resistant exercises that result in you lifting weights. And so there's the aerobic exercise, resistant exercises, and so that's in general what we're talking about. And
That is,
uh,
Okay.
you need to call.
John Buchanan, you had a comment.
When would be a good time to stop by?
Yes. So now, nowadays, I exercise 3 times a week. I swim 1.2 miles. It's like an hour and a half, 3 times a week. But when COVID hit, they closed all the swimming pools, so I had to start walking. And I started looking at my steps on my phone. I was surprised to learn that going up and down, like Betty was talking about, going up and down those stairs is one of the measures that they take, and also grocery shopping. I mean, going back and forth in that, I was surprised. I put on like almost a mile grocery shopping.
Yeah. Yeah, that's right. The grocery shopping, you're walking and walking and walking and walking. Yeah.
That's
Any other
kind of,
comments about the exercise?
I said that's kind of what I meant. Just regular things that we do, and sometimes it does get your heart rate up, sometimes it doesn't. But it's
Well, but the exercise that you need to do is the exercise that gets your heart up.
yeah,
That is
okay.
aerobic
That's the main
exercise.
thing. Okay.
And grocery shopping, walking back and forth is an exercise.
Okay.
Any other comments? Because it does pay off, but
After you see your grocery bill, your heart rate can go up.
okay, Dolores, did you have a comment?
Yes. Right now I exercise 7 o'clock in the morning. I do 3 miles every morning, Monday through Friday.
Wonderful.
I start out with just, a little, and I work myself. I've been doing it for 2 years now.
Wonderful.
And, the fresh air helps too, to step out of your environment.
Wonderful. Thanks for sharing, Dolores.
Mm-hmm.
Good. Okay, let's go to the next article then. This is interesting because it's interesting, just discovered. Well, there's been a number of articles that have demonstrated the benefit of coffee. I'm not a coffee drinker, but a number of articles have identified that they affect the gut bacteria. We had discussed that last week. And we also talked about the fact that it can help with diabetes and other factors. So that the article last week talked about the impact of coffee on certain good bacteria in the GI, gastrointestinal tract, which promotes good health. And so, they talk about probiotics and somebody talked about prebiotics that John Buchanan asked about last week. And so it does seem to be safe to have 1 or 2 cups of coffee a day. And of course, most Americans uh, want to take coffee to stay awake and to be active. And it does seem, as we talked, there was an article that talked about the negative effect of using sugar in coffee and using sugar substitutes. But the coffee itself has many ways in which it is healthy. And so if you coffee drinkers are doing something that is beneficial to your health. Are there many coffee drinkers out there? Tea drinkers as well. Yeah.
I'm having a cup right now.
Okay. All right.
Yeah, Carol drinks coffee, but she puts a lot of stuff in it. Different stuff,
Okay.
flavoring and cream and all that.
Okay. Let's go to the next article then, please. How to stop eating so much ultra-processed foods. Of course, we've had many articles on the impact of ultra-processed foods and how they are counter to healthiness, how the emphasis should be on vegetables and fruits, and the less ultra-processed foods you eat, the better off you will be. And there's article after article after article that emphasizes the importance of decreasing, if not eliminating, ultra-processed foods. And so many of the studies, and there's just so many studies that show the same thing, that when they compare the people who eat ultra-processed foods and those who eat more fruits and vegetables, the people who eat the fruits and vegetables are much healthier and live longer than those who do not. And this, of course, contributes to what Dallas talked about in the marked obesity that we find in America. And so the question is, how do you go about it? And how do you avoid ultra-processed foods? And when most of the foods that are available are often ultra-processed. And I think they identify things that contribute to the unhealthiness of that. And I think these articles have talked about olive oil and other things that, and then of course the sugar and the salt are things that aren't good. But I think the big thing to do is to emphasize the importance of fruits, vegetables, and minimizing the amount of sugar and salt that you eat, and then doing those things that are essential, like altering your lifestyle. When they talk about how much ultra-processed food is safe to consume, well, here they identify some milk substitutes that they recommend, and And I think that when we talk about ultra processed foods, it reminds me of when we talk about the microplastics, because at least the new Secretary of Health is planning to do much to try to minimize the ultra processed foods and emphasize the importance of vegetables and fruits. Any other comments that you want to? Okay, let's start with Dr. Perez.
I know from this group, I've learned I tried to have more fruits and vegetables, and I realized that some of the vegetarian products that I was looking to were more processed than eating flesh. So from this group, I don't think I would have been as discerning, because I thought that the fruits and vegetables were better. And many of the vegetables that are put together are processed. So I appreciate the discussions that we've had in the past on this concern.
Okay, Darrell?
Yeah, if you get it in a package, like packaged mac and cheese, that stuff is processed. We know it is. About the only packages that are safe are like frozen peas, frozen green beans, frozen carrots, frozen whole foods that are not processed. There's some things that we don't suspect are processed, but like French fries, commercially prepared French fries. They're considered ultra processed foods due to extensive industrial processing and additives they undergo. It's okay to eat fries. Yes, eating fries once a week is generally considered acceptable as part of a balanced diet, um, but that's about as much as you want to go. We know potato chips are ultra processed. We don't usually think that French fries are, but the only way you can be assured that French fries are not ultra processed is if you slice up the potato and you fry them at home.
Thank you, Darrell. John Buchanan.
Yeah, I had a question maybe directed at Darrell about cereal. Cereal used to be regular breakfast item, and so what's the deal? Is cereal ultra processed, and is it safe or bad or good, or what's the deal with cereal?
Oh, here's AI's, not me. It's AI. Says yes, most commercially available cereals are considered processed foods. If you get what they call it, raw oatmeal, not the stuff that's sugar added, but raw oatmeal, that can be considered not highly processed. But the rest of your cereals are generally considered processed foods. And what makes them worse is, most people like to add milk to cereal, and especially for highly melanated people that are lactase non-persisters, where they don't have the enzyme to digest milk properly. Adding milk is very problematic to cereals, and so I would encourage everybody. If you see a box of cereal coming your way, if it's not pure oatmeal, please run the other way as fast as you can.
Also, you can have lactate, which is milk that doesn't have that you can drink even if you're lactose intolerant. Any other comments about this? Because unfortunately, we kind of are what we eat. So,
Is almond milk good?
say again.
Almond milk. Is that good milk? Almond milk?
Almond milk. Yeah,
Oh.
they mentioned that as a good alternative. What are your thoughts about that, Darrell? Almond milk.
What I encourage, I think the best plant-based milk would be coconut milk. But whatever, if you get a plant-based milk like almond milk or coconut milk, make sure you get it with unsweetened, without sugar, because they add the sweetener that's high fructose corn sugar, and that's very problematic. And the reason why a proponent of coconut as opposed to almond milk is that almond is a man-made hybrid rather than a natural hybrid, and that is not as digestible as non-hybrids like coconuts.
So you have two different opinions on the same subject. Uh, okay.
I have some pills in my hand. Dairy relief. You can. My doctor prescribed these if I want to digest better when I'm taking milk products and milk products. It's a dietary supplement.
Okay, thank you very much for sharing. This is an article that talks about the fact that we probably don't think about personal care products, but actually personal care products have more microplastics than you could imagine. And this goes into detail to talk about the different types of face scrubs, body washes, and toothpaste, and so forth, and all of which are associated with microplastic ingredients. And all of the studies have found microplastics in every aspect of our bodies, from the brain down to the toes. And so, in spite of all of this, plastic-derived chemicals are projected to triple by 2060. So our exposure will be ever increasing. And there's no actual regulation of microplastics. So this is an area that, as we talked about at the beginning of this program, that has avoided attention. Hopefully, maybe with the new administration, they may pay attention to it, because it's something that is harmful and is affecting our health in more ways than we can imagine. Any comments about the fact of the harmful nature of microplastics and the fact that we have no efforts yet to address this devastating product?
Yes, Dr. Callen, we have had several international organizations that have looked at microplastics, but not necessarily how they directly affect us, but the fact that we're pouring these plastics into the ocean. And, most folks think that the ocean is so big that nothing can really damage it. But we have found microplastics in fish. Fish eat them because they think that they're food, and then we eat the fish with these microplastics in the fish meat, and it's growing, and especially like the area, the water that's close to the land. So much plastic is going into the rivers and the bays that are right next to the continents.
Yeah, and that's just one source of it, as we recognize. There's so many sources of it that we don't even address. So this is a problem that does deserve national and international attention, and more addressing the ways in which we can address these harmful products, which are not identified yet as harmful products.
John, can I see the title again?
Yeah, there's also an app, and I forgot to get it. There's an app that you can scan the bottle of your face wash, or your body scrub, or your whatever you use to clean your body with, to see if it's got these plastics in it. And you'd be surprised how many of them have these microplastics.
Well, according to this article, just about all of them.
What?
They're also in toothpaste.
Yes, they mentioned that as well.
all kind of body scrub.
That's right. That's what they mentioned. They
Yeah.
mentioned.
The reason why I asked you to go up to the top, I wanted to see, however, if women would especially have to worry about this because of all the makeup, lipstick and stuff that they use.
Okay, well, it's everywhere, so okay. So we need to be aware of it. And our government needs to be aware of it to try to help us as we address it. Although it seems to me that we're so far behind, there's going to be a very difficult problem to address. Next article, please. But at least we are aware of it. This is an article that talks about people who have obstructive sleep apnea. That's what OSA stands for. And still have uncontrolled hypertension. That CPAP, which is a type of respiratory treatment, actually eliminates the uncontrolled hypertension, so that those people who have obstructive sleep apnea and actually use sleep apnea products at night, if they added CPAP to it, it would address the blood pressure problem. Although obstructive sleep apnea in general, when treated, hypertension is usually controlled, but there are some circumstances in which the hypertension persists. In those situations, CPAP is recommended for control. And this doesn't involve many people, but it's something that bring to your attention. CPAP is a respiratory treatment that forces oxygen into the interstices of the lung and allows oxygen to really go deep into the lung tissue, which allows for dilatation and decreases the blood pressure. Let's go to the next article. This, of course, obstructive sleep apnea is found often in people who have obstruction to the respiratory system, and also people who are obese and overweight. And there are a number of ways of treating sleep apnea. One is by taking treatments at night, and there's another operation that is done to the paralyzing the phrenic nerve to some degree that allows obstructive sleep apnea to be overcome. Now, this is an article we have talked about before to some extent, that we're talking about coronary artery disease, coronary calcium scoring. They have a way of looking into, doing x-rays and looking into your coronary arteries and identifying how much calcium you have in there. And also, when they identify that you have a certain amount of calcium, they then recommend statins that reduce the cholesterol and stabilize and decrease the accumulation of arteriosclerosis in the coronary arteries. So they're recommending that people get coronary artery scoring, and if you get the scoring to take medications that will reduce your cholesterol level and stabilize the extent to which your coronary arteries become blocked, because a blocked coronary artery means heart attack, which means death. So this is something that is relatively new, although it's not brand new, but it's kind of new. But it's something that here's a problem, and I think down in the article it talks about the fact that sometimes insurance doesn't cover it, and of course, as John Buchanan would have asked, how much does it cost? It costs an additional $250 that maybe your insurance policy wouldn't pay, but it's worth it because finding you have high calcium deposits in your coronary artery can be treated, and this treatment can save your life. So it's worth the $250 to pay for scoring. And this is something that all of you should be aware of now, so that you can talk to your doctor about it. So that I read where somebody just dropped dead from coronary artery disease, and there's an interesting article that said most people who drop dead from coronary artery disease don't have a history of any cardiovascular disease before. And so very often it is asymptomatic. So getting the calcium scoring of your coronary arteries is something that could be life-saving. Any comments about this? Because it's important for all of you to know about it. Because
I have a question.
Yes.
When you get your score, and your score is very bad, what do you do then?
That's what we said. You get on statins. Or if it's really bad, then you may need stenting or a coronary artery bypass. It all depends upon how bad your coronary artery score is.
Okay,
How much calcification you have in your arteries.
Okay, thanks.
Any comments that any of you have had about the scoring and the wisdom of getting it done and the benefits?
Dr. Callender,
Yes.
I thought that drinking milk and dairy products was supposed to be a good source of calcium, which was supposed to be good for you.
Well, that's the dilemma, because too much calcium in the vessels causes occlusion of the arteries. So that, yes, there is some benefit of calcium, but in the coronary arteries, no. In the coronary arteries, you don't want to have a whole lot of calcium. Because calcium begets occlusion, and occlusion means that your arteries to the heart muscle are blocked, and you get that's not consistent with life. So yeah,
So
calcium may be good, but it's not good in the coronary arteries.
it's good for your bones, right?
Yeah, it's good for your bone, but not for your coronary arteries.
Hmm.
Daryl?
Yeah, better source of calcium that's heart healthy is dark leafy greens, kale, mustards, turnips. Yeah.
Okay, thank you. Thank you. Any other comments? So if you can, this is something that those of you who are over 50 would be beneficial to have done. And if you have a high score, then the appropriate treatment as recommended by your physician is what is the next step.
One other treatment is calcium supplement.
Say again?
Calcium supplements.
What about calcium supplements?
That's another.
Well, but I don't think that's advisable unless you've already had calcium scoring and you find out whether or not you have calcium in your coronary arteries. Because
Oh no, what I was saying was, my doctor prescribed calcium tablets because my calcium was low, not because the scoring. It's just my calcium.
okay, okay. For hypocalcemia, yeah, okay.
Yes.
Okay, we'll go to the next article. There's no comment. So we're finding healthier lifestyle linked to almost lower risk of everything. Cancer death is no exception. And this is a study that looked at
Fix me a pancake.
healthier lifestyle. And of course, healthy lifestyle means that you stop smoking if you had been smoking. If you never smoked, it's good. But healthier lifestyle means exercise, healthy diet, not being overweight, and all of this lowers your risk of death from any cause, and also from cancer. And so many of the things that we talk about that we may take for granted, it contribute to a healthier lifestyle, meditation, exercise, having a diet poor in ultra-processed foods and rich in vegetables and fruits are some things that go along with a healthy lifestyle. And this then is associated with a reduction in death risk and mortality risk and cancer risk as well. And so all those things that we talk about that recommending a healthier lifestyle contribute to decreasing your likelihood of death and decreasing your likelihood of cancer. And even if you have cancer, decreasing the likelihood of dying when you have cancer. So all the things we're talking about are good for you. Any comments or additional comments about this article, which 50% lower with a healthier lifestyle is quite a bit. So adopting a healthy lifestyle is worth its weight in gold in many ways. Okay, let's move to the next article then. Now, it's interesting that this would say stress is a new cancer risk factor because we've known all along that stress is a risk factor for all aspects of life. And of course, we people of color we have stress because people look upon us differently and think we're entitled to nothing. And, I think often of what Charles Drew said, that excellence of performance overcomes the artificial barriers created by man. And in many instances, this is true. In many instances, excellence in performance is a way to overcome it, but in many instances, their prejudices and discriminatory practices remain the same. But excellence of performance still is important. But stress is well known to impact. When they did an autopsy on Martin Luther King, they found he had many evidences of arteriosclerosis and cardiovascular disease entities. And that's something that we as people are associated with because of the stress that we have. The pigment of our skin makes it difficult for others to recognize that we're human beings in some instances. And so as a consequence, they discriminate against us because they think we're different when we're not. So this stress impacts upon us in a very negative fashion, and it is killing us. And so we need to identify ways to overcome the negative impact of stress. And meditation, exercise, and those other things that we talked about, the healthier lifestyle, nutrition, etc., is a way of addressing it. And I think none of the things is any more important than something that we tend not to emphasize, which is the importance of meditation. Dr. Perez.
And as it's important to point out the intergenerational impact. So that women who are stressed out, especially during pregnancy, that has an impact on them and their children. We haven't done enough research as it relates to the male components to fertilized eggs, their sperm, but we know its impact on women. And recently there was an article that was released, and despite the decrease in maternal mortality across socioeconomic status, the only category for which it has gone up is Black women.
Thank you for sharing. Okay. Any other comments about the impact of stress and its effect on the T cells that give you immunity? And this then is the way in which stress negatively impacts your health by decreasing the ability for you to fight off foreign invaders and infections of any type. So, yes, we are stressed. And so the importance of meditation often is omitted from the factors that can contribute to a healthier lifestyle. And I emphasize that every chance I get. Any other comments about yoga and mindfulness, Tai Chi, and those things that will also help all of those of us who are stressed? Because the stress comes from many reasons. Black pigment is a wealthy source of stress. Any comments? Other comments?
Yeah, Dr. Calendar, last year I started taking golf lessons because I thought, I always thought golf was cool, but I'm so bad at it, it causes me stress.
Okay. Thanks for sharing. Okay, well, let's go to the next article. And we have more and more evidence that plant-based diets reduce cancer risk. We talked about this ad nauseum, and the plant-based diet is the way to go for almost everything. And more and more studies are demonstrating this. This is a study that looks at it from a different perspective. But there's so many papers that say the same thing, that more plants, less cancer. So, and one of the things that's happened as a consequence of this session, particularly because of Dow's contribution, is most of us recognizing that we need to have more vegetables and fruits, and decreasing, if not eliminating, red meats. Any comments on this? This is a subject that we have not left alone. We've talked about the vegan diet, the vegetarian diet. Dow has educated us session after session. And so most of us, if we weren't before, we are now eating many more plant-based diets than we were before. Maybe not vegan or vegetarian, but still highly influenced to eat more plants and vegetables and fruits. Any comments or questions? Because the data is clear on all types of cancer that the more vegetables you eat, the better off you are. Any additional comments that you feel are appropriate? Please share.
It's kind of it's
Betty, you
Yes.
want to say something?
I'm just thinking that I think we all realize that, but it's harder for me anyway, as you get older, you think about the easy way to do things, and that's when you go to those processed foods and stuff instead of cooking from scratch.
Okay.
And so you get used to it, and it's harder to go back the other direction. So, but I know, you realize you should, but it's hard. And I was just thinking about it when I have oranges in my refrigerator, but before I reach for an orange, I'll reach for the orange juice.
Yeah.
Just drink it. I could just pour it in a glass and drink it instead of having to cut it and go. So we've come so far the other way, it's hard to go back.
Any other comments? Okay. Well, we'll move to the next article, but I think the message is clear.
Yeah, to Betty's comment, that's how grocery stores make their money, because they know that we don't feel like doing everything. You can go to the store and everything's all cut up for you. A pineapple is all cut up for you.
Yeah, they're smart. They're smart. This is an article that just says that physical activity, whenever you do it, is going to help whatever you have, and particularly even cancer, whether you have it or are going to have it. Exercise is going to lower the likelihood of death from cancer. So physical activity is a must. You know, when you get over 40, uh, physical activity and exercise is, in my perspective, is mandatory. Um, and this study, along with all the other studies that we've had, demonstrate without question that point that it's pretty much mandatory. We got to do it, whether we like it or not. And I think we can learn to love it because it's going to help us live longer and have a more quality of life. Dolores, did you want to say something?
No.
Oh, okay. All right. Okay. Let's go to the next article. This is an article that just says that exercise is good. It doesn't say that it reduces cancer risk, but it says that there's data that suggests for some cancers, it does reduce the cancer risk. And for some cancers, it doesn't. But the bottom line is the physical activity is better for you under all circumstances, whether it affects the cardiovascular system or prevents cancer or it makes you healthier, makes you fitter. It's something that we have to accept as an important part of our life as we age. As you get over 40 and move towards the 80s, it's something that will positively impact your ability to have a quality of life as you age. Any other comments that you want to make about this article? I know you think we physical exercise you to the limit, but it's positive. It's positive. Article after article is saying the same thing. It's just that some cancers it's more beneficial for than others. But there are other factors as well. And of course, we talked about the other factors of diet and meditation and so forth. Okay, let's go to the next article then. There's no comment.
Oh, well, I got a comment that
Okay.
yeah, we know that exercise can affect hypertension. Regular exercise can bring it down several points, both the high and the low numbers. What we don't talk about very often is the interconnectedness of hypertension and cancer. And I'm looking at AI saying that high blood pressure and cancer are two interconnected conditions with complex interactions.
Thank you for sharing that, Daryl. Thank you. Yeah. Of course, that also means that the thing with hypertension is that people that take their medication and have their blood pressure controlled. Because one of the things that bothers me most about a lot of the studies I've read is that when you look at the mortality from cardiovascular disease, which is the leading cause of death in the world, the mortality rate has not changed. And I think it's because the people with high blood pressure don't take it very seriously. When we do our screenings, most of the people who have hypertension, those people who are actually on medication but aren't taking their medications. So if you have hypertension and you're not taking medication, then your blood pressure is not controlled, which means you will still have complications of hypertension. So it's important to monitor your blood pressure, take your blood pressure medications, and have your blood pressure controlled, because as Darrell says, it's related to cancer as well as many other causes of death.
Yeah, we can thank Alan Iverson for that information.
Allen Iverson?
Yeah,
Why are we thinking Allen Iverson?
because that's who AI is.
No, AI is not Allen Iverson.
You got it. You know,
Artificial information.
the artificial intelligence.
Okay.
You know Alan Iverson too, though.
Yeah, I know. One of my favorite basketball players. Mediterranean diet may cut the risk for obesity-related cancers. This is a diet that is well known, that includes vegetables, legumes, fruits, nuts, seeds, dairy products, including meat and meat products, fish and seafood, and so forth. And adherence has been associated with reduction in obesity and obesity-related cancers. I think Darrell has talked ad nauseum about the fact that we're obese, but we haven't shown the connection between the obesity and cancer, which exists as well. And this is demonstrating that the diet is associated with the lower risk for cancers of many types. So this is an important contribution, demonstrating, and you wonder if there's any limit to the way in which the food we eat interacts with us. And I think this is another manifestation. Let's go to the next article. And yes, healthy lifestyles improves survival in non-metastatic prostate cancer. We know that prostate cancer is a disease that often is not so aggressive that it kills you, because many people with prostate cancer die of other conditions. And more often than not, the prostate cancer is not the source of the death. But this article is pointing out that those people with healthier lifestyles, whether they have metastatic cancer or not, are helped by having a healthier lifestyle. And of course, this is particularly problematic with the Black male. So for our Black males, we have a higher death rate than women, Black women. This is important to recognize that a healthy lifestyle impacts prostate cancer as well. Next article, please. Now, this is an article that I thought was very beneficial, and it says something that no other article I've read says it as clearly as this one, and that is that no matter what age you are, whenever you stop smoking, it's going to help you live longer, regardless of how old you are and all that. Whether you stop at 25, 35, 45, 55, 65, or even 75, your chance of living longer are better if you stop smoking. Of course, it's better if you never started smoking. But if you have smoked, since there's no health benefit, whenever you stop smoking, it will lengthen your life. And so for those of your children, grandchildren, and great-grandchildren, it's important for you to help them understand that whenever they stop smoking, it will lengthen their life. Any comment or questions since most people who live to be your ages are not smokers. Your children and great-grandchildren, great-grandchildren who smoke, you might share this information with them. And here again, diet quality is associated with psoriasis, which is a skin condition associated with arthritis and other aspects. This is a study done in the UK. It may well be applicable to the United States, but all it's saying is that healthy diet works with almost everything. I think that's the essence of this. And nutrition is so important. It's time for us to have another presentation from nutritionists, I guess. So I'll speak to that. Okay, let's go to the next article if there are any left.
Last article.
Last article. This is an interesting article that I've not seen before. That shows that if you have cutaneous lupus, that if you take this medication, there's 87% less likelihood if you develop systemic lupus, which of course is a lethal problem, and particularly in Black women. And so this is identified in the study, which is very impressive, although it needs to be done in other populations and all populations and all ethnic groups. And this was, for the most part, a European study. Whether it's appropriate to us or not, I think it's food for thought for those people who have lupus that is only in the skin, but is likely to move to become systemic lupus erythematosus, that this will prevent the conversion of that skin condition to the overall systemic lupus, which is fatal to many of our Black women. Okay, well, I think this completes all of the articles we have. And remember again, next week we have Dr. Frederick, a former president of Howard University and oncologic surgeon, who's now actually interim CEO of the Sloan Kettering Cancer Institute in New York City. Will talk to us about steps we can take to prepare for the new administration. And so you can invite your friends to be present for next week in his presentation. Any comments or anything else that you want to share before we leave?
Say why America.
Thank you. This was wonderful. I so appreciate it.
Okay, so God willing, I look forward to seeing you next week with Dr. Frederick and a discussion of how we face tomorrow and how we can best prepare ourselves for 12 months of a new way of living.
The app that I found that you can scan your body wash and your packaging. It's called Beat the Microbead. BEAT the Microbead. If you copy that down, you can download that app, put it on your phone, take your phone and scan the package, and it'll tell you if you've got those plastic microbeads in your body wash or your toothpaste or whatever. Beat the Microbead.
Okay, see you next week. God willing.
Ciao.